Welcome, 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 welcome. For showing up today to our labs masterclass series, thyroid. We're going to talk all things thyroid, not just labs, but all things thyroid. And let me introduce myself to those of you who don't know me. I'm Susie Tobias. Nutrition and functional medicine is my life. And today we're going to unpack a lot of things about the thyroid that I think a lot of people are confused about and give you a little bit of education. For starters, this is not medical advice. I'm not your doctor. I'm not treating you. I'm providing education. All right. So if you have this, we just go there. All right. I want to give you first and foremost my story when it comes to the thyroid, because when things are personal, they're personal, right? And when you learn things and you find out things and you know things, you become better at things. And I feel that when we go through things, it works even better, especially as a practitioner. So, out of nowhere, all of a sudden I was just exhausted. Okay. Like, I mean, dead dog tired. I can't function, exhausted. And I didn't know what was wrong. I mean, like we're talking like I'm an athlete. Okay. I go Mach 2 all the time. I couldn't function. And I was like, well, what is going on? And so I ran labs and I was like, and I can lie, the very first labs that I shot at myself, I started to not even run a full panel. And I was like, what are you doing, Susie? Like, you know better, all right? Here we go. Normal conventional medicine, when they run lab work on you for your thyroid, they're going to run TSH and maybe they're going to run T4. Okay. So maybe, my TSH came back dead normal. Okay. Absolutely normal. Any doctor would have looked at that and been like, it's not your thyroid. My T3 and T4 were almost non-existent. Like there was nothing there. Like when I sat there and I was like, okay, I need meds. And I called up a naturopath in town who I had actually gone in and had an IV with about 6 months prior to. And I'm not kidding. I walked up the stairs. Well, I thought to myself, my husband was in the Navy at the time. I was going to go to them. And I was like, what are you doing? You know better. You know better. Don't do this. So I walked up the stairs and I got to the top of the stairs and laid down on the ground. And I was just, I laid there and I was like, I was short of breath. I barely even made it in his office. And I walked in and I handed him my labs and he looked at me and he said, look at this. Wow. Oh, honey, like, normally I would say, let's support your thyroid with some supplements. Let's do some things to help you out here. And he said, but honey, you got nothing to support. And I looked at him and I go, I know. And he goes, you came to me for drugs, didn't you? And I was like, I did. And he's like, I don't even think I should charge you. Like, you really did all the work here. And I was like, just bless you. Now, I was even more blessed in the situation because the compounding pharmacy that he works with, he's phenomenal and he doses to numbers. Okay. So he looked at my numbers and he was like, we're going to start you out at 240 milligrams of Armour Thyroid. Nothing, kill a bear. Okay. 240 milligrams. Like he was like, this is awful. Now, again, had I gone any other route, if I would have even gotten medicine, they probably would have started me off on Synthroid, levothyroxine. I probably would have got like, I don't know, 25 micrograms, maybe, who knows, right? But it was not, they never would have been enough. Anyway, these guys had medication in me within an hour and a half. Did you not? And I was functioning almost up to normal speed within a week. Okay. Now, I can't imagine had I not known what I know or did what I did or got the right help that I got, because what happens is a lot of people, they're in this situation where they don't feel well and their doctor runs labs, TSH is fine, and they dismiss it. Go ahead. No, it couldn't be your thyroid because your numbers look fine. But they're not looking at the whole picture and they're not looking at all the numbers in the right way. And so to take it a step further, now my brain, you know, medically, I'm like, what's causing this? Because your thyroid doesn't just shut down for no reason, people. Okay. Like there's a reason behind this. And I was like, why? Okay. So I started digging. Okay. I start looking at what does the thyroid need? The thyroid needs iron. It needs iodine. I'm like, I'm like, okay, hang on. Maybe I'm anemic. Okay. I run more labs. Comes back and my iron levels are crazy high. What? Short story, I have hematomacrosis. I am a iron loader. Didn't know that. Okay. Well, all of this never has been a problem before. All right. But you know, this is the thing. You can have you can have genetics working right here in the hand. All right. It's basically like the loaded gun. All right. But it doesn't mean it's going to fire. Doesn't mean it's going to come for you. Doesn't mean you're going to end up with it. But when you have something happen in your body to cause a little explosion, a little eruption, that gun can go off. All right. So again, now I'm like, well, why? That's my question. Well, why did this happen? Mold toxicity. Okay. We lived in military housing. We had mold. All right. Mold. And it literally wiped us out. And so this is my own personal story. I ended up, and it's funny, I didn't have Hashimoto's in the beginning. Okay. And this is the thing, when you have a pathogen inside of you for a long time, all right, it's going to affect your immune system. Your immune system is going to be hyperactive. And eventually, and that's what happened. I didn't treat it right away. We were still in the environment. We hadn't moved yet. Once we moved, I started to treat it, and, you know, I ran more labs on myself, and I've been running labs. All right. And all of a sudden now I'm popping with antibodies, and I'm like, Hashimoto's, are you, oh, you came for me, didn't you? Okay. So now there we sat. Okay. So here I was, hypothyroid, Hashimoto's, mold. All right. Do I have Hashimoto's now? No, I do not. I went after the mold. I went after the root cause. All right. And I put my Hashimoto's in remission. And we're actually in the step down stages still of getting me off of medication. So, which has been really interesting because, my doctor, got a new doctor, we moved, different town. And when I told her my story, and she's like, okay, well, let me run some labs on you. And she said, well, hang on. She's like, what do you need me for? And like really, like you're managing, you got all this, and you're like, you get your meds from your naturopathic. Why do you need me? And I was like, I don't want to pay for my labs anymore. I just don't. And also, if I have something go wrong, something bad happen, I don't know, and which I blew my eardrum out in my hyperbaric chamber. So, you know, things like that. I'm like, I probably need some help. And so she says to me, hey, I'll run labs on you. I'm gonna run a full panel on you. I don't do this though, because I don't know what they mean. And I was like, I appreciate your honesty. She goes, I don't know. I have no idea what it means. Like it's she's not trained in it. And that's the thing. Well, a lot of times we get angry and frustrated with the doctors because they're not running the labs. Well, what I've realized is there's two factors happening. A lot of times they're not educated. Okay. And then when you challenge them, they get defensive and they push back, or it's an insurance issue. Okay. So they have to be very selective on how they write things up. When it comes to ordering labs, because insurances won't cover things, a lot of things. And so you've got to have the symptoms. So you've got to have a doctor that's going to do that. All right. And a lot of times they just, nope. And the other thing is, what happens if I run all these from a doctor's perspective and the labs come back and I don't even know what they mean and things are wrong. You know what I mean? But you're just like, hi. So it's twofold. So anyway, I want to go in and I want to give you guys some explanations on some things, some understanding. I have a lot of people who think they have thyroid issues. I have a lot of people that do have thyroid issues. I have a lot of people who have labs that look absolutely normal, but they're exhausted. They can't lose weight. Their skin's dry. They can't poop regularly. I mean, there's so many different things going on, and I'd like to explain to you what and why tonight. So let's roll. If we were to take a great little look here at me clicking things, we could see the little path here. Okay, so what we have going on here is it's kind of like you're sending out messages to different places. All right, like all the action doesn't start in the thyroid; it's not staying in the thyroid. We're looking at first and foremost starting in the hypothalamus. The hypothalamus is going to send out a signal, thyroid releasing hormone. Okay, and it's going to send a signal to hey Bob, or hey P, pituitary gland. All right, we're going to shoot a signal over to you. All right, and we're gonna send something there. Now, the pituitary gland, okay, the numbers you guys were all looking at, your TSH, right, that gets normally ran for you. This is where this happens. Okay, so the pituitary gland is going to basically go on a search. Okay, it's looking for in the body, how do I need to stimulate the thyroid or not? Okay, that's the big question here. Do I need to stimulate the thyroid, and how much? Okay, if I'm looking in the system, I'm trying to pick up free T3, free T4, how much do I need to release? All right, so that's what that number actually looks like. So when we're looking at TSH, if your TSH is shooting high, it's saying I'm not finding what I need to find. We need to pump up the volume, and we need to push more out of the thyroid. Okay. If the TSH is shooting low, the body's going to say, whoa, we got enough here. Okay, well, let's slow it down. All right. So that's kind of the command center on what's going to happen. So it sends a signal to next your thyroid. Now your thyroid is going to send out free T3 and free T4, okay? And it's going to send it out to the blood, into the liver. Now, the majority of this comes out into free T4, and we'll get into that in a minute. It needs to be converted into free T3, which is the active form, all right, in order for it to actually get picked up into the cells. But in order for that to happen, there's a lot that has to happen within the liver before that conversion happens. There's certain nutrients that need to be present: iodine, iron, selenium, zinc, B1, B2, B12. You got protein. There's a whole. We'll get to the nutrient section in a second, but that all this stuff has to happen, and your liver has to be working well, right? Can't be junked up, can't be congested. It's got to be functioning well so it can make that conversion. Now, once we have free T3 floating out inside, it's got to get into the cell. That comes next, and then the cell is going to send another signal back up to the hypothalamus. Okay, so that's the circle of life here. So if we were to look at this, we refer to this as the HPA axis. Some people call it the hypothalamus pituitary thyroid axis, HPT. Some people call it HPA. It's basically all these guys together. All right. So your hypothalamus is basically, it's the control center for your autonomic nervous system. All right. Your autonomic nervous system is the system that controls, your heart and your breathing and everything else. Okay. This is stuff that just naturally happens. All right. But it tells the thyroid to either increase or decrease metabolic function by sending it to, like I said, to the pituitary gland. So that's the thyroid releasing hormone that we talked about that needs to get out. All right. So next we hit the pituitary gland. All right. And this is where, again, we pick up the signals, and we've got to send things to the thyroid. And it's either going to kick it up, turn on the gas, man, or put on the brakes. It's going to let it know what to do. All right. He's the chief. He's the quarterback. He's calling the shots here. So now we have, again, back to the thyroid gland. Okay. It's funny because thyroid issues are rarely a thyroid issue. Okay. Everything's I have thyroid issues, and it's really that. It's either it could be a nutrient deficiency, it could be signaling, it could be gut issues, it could be pathogens, it could be your adrenals. We'll get into all that. But the thyroid function alone, I mean, it controls your body temperature, your bone health, blood sugars, hormone metabolism, nutrient absorption, and motility. Okay, so pooping. That's one of the big symptoms that I see for people when they have intake forms and they're like, I'm constipated all the time, I'm cold, and I'm tired. And I was like, you should check your thyroid. So back to T4 and T3. So this is the big kicker here. 93%, ready? 93% comes out in free T4. Okay, this is inactive. 7%, the active form of thyroid hormone, is coming out in free T3. 7%. So your body has to do some work here, okay? Like it has to work hard to convert. It has to convert free T4 into free T3. And in order to do that, there's a lot of things that need to happen. So again, this is how your metabolism is going to work for you or against you. And it all depends on what's going on more so in your body, not so much what's going on in your thyroid. So why does the conversion matter? Okay, so again, the pituitary gland, it releases THS and tells it, what to send out. And we've got to do the conversion. All right. Now, this is the deal. If the conversion is poor, okay, and this is the thing, your TSH can be totally normal. It can be completely normal, even if you're having poor conversion. And when you have that, you can experience, symptoms like fatigue, depression, like I said, the cold things, concentrating. Oh, hello, brain fog. Like, hello. Anybody who's got a thyroid issue, brain fog it's hard. It is. So it's important to assess the conversion, okay, of T4 into active T3. And the only way you're going to assess that is by getting the right labs, okay? Because we're not going to know what T3 is doing if we're just looking at T4 and TSH, are we? Nope. Going to be completely in the dark. So T3 is what's going to have to get into the cells, all right? So that's going to make all the difference in the world on how your body is healing, all right? The conversion of T4 to T3, the process can negatively impact it, ready, by various factors, all right? So most of it converts in the liver, some of it's going to convert in the GI tract, and some of it in the muscle tissue, okay? And what can impact that? Well, parasites can, yeast, candida, bacteria, viruses, nutrient deficiencies. There's a whole host of things, toxins, that can put a burden on your liver, all right? That can make it so the conversion doesn't happen well. And that's the other thing we can look at too in labs, is we can look at liver function. What does that look like? Like if you look at your AST and your ALT, you look at your GGT, what do the numbers look like there? If your liver function is not great, I guarantee you your thyroid function is not going to be very great either. All right. So looking back at my labs during that beginning phase of everything, my liver was a disaster. Okay. Like it was like, yeah, my labs were just a hot mess. Every day, I did a lot of labs, and every time my labs would come back in, I literally would have a panic attack because I was like, am I gonna die? Like, I know I'm not, but please, this is one of the worst things I've ever seen. All right, so we need to talk about nutrients because this is a very important thing here. Okay, I want you to know that is not a butt up there. That is the picture of the pituitary gland. I am no Van Gogh. You call him what you may. I'm not good at this. All right. So again, free T3, free T4, 93% coming out of as free T4. Okay, 7% of free T3. Now you need magnesium and zinc and B vitamins for the pituitary gland to actually even kick off. All right. And as it's going down into the thyroid, you need zinc and you need adequate protein. Okay. And this is where it gets kind of sticky. A lot of people get into different types of diets and they don't get the right nutrients for the right things. Okay. So a lot of people I see, vegans, not picking on you. Okay. I'm not gonna pick on you. I love myself. I have vegan times in my life all the time, but there seems to be a lack of B vitamins with vegans and also iron, which is also important for literally every cell in the body. Okay. And so when we're missing those nutrients, and same thing with adequate amounts of protein, a lot of times that we can be missing those and it affects the function of what? Your thyroid. Okay. So again, we go down, we're talking down to the thyroid, which is going to spit out T4. All right. And we need vitamin C, we need B2, B3 for the transport. Okay, so remember, these things have to transport down to places. And now with the liver, you need iodine and you need protein. Again, you need all of these things for that conversion, especially selenium. Selenium is a big thing for that conversion, all right? In order for us to get over to the cell. All right, now we've got this free T3 running around and you've got the cell, okay? And at the cell, there's a thing called reverse T3. Okay, so think of free T3 as the gas pedal. Okay, this is your gas. We're going. At the cell, you have reverse T3. This is your brake. Okay, this says, I've had enough, or I'm going to stop some things from getting in. Okay, a lot of times we can have problems because reverse T3 can be too high. Okay, or we don't have the right nutrition, okay, nutrients to get things into the cell, because at the cell, you need selenium, you need vitamin E, you need vitamin D, and you need omegas. And if we're deficient in those things, we're going to have a hard time getting into the cell. So it's a whole process, again, back to nutrition, that really matters with this conversion. So what can hurt the conversion? Okay, there's a lot of things that can hurt conversion, and I'm going to really soapbox. I should save it for last. I really should, but I won't. We're going to start with stress. Yeah. Stress is one of the things that seems to kick us in the face. Can I be honest with you guys? In times of chronic stress, your body releases high amounts of cortisol. Okay, that is your fight or flight hormone. And when it does that, your body, cortisol trumps all. Okay. All right. So this is the deal. When cortisol screams, everything else kind of slows down in the body, meaning we're going to divert attention. We're going to divert everything from thyroid production. We're going to slow the metabolism. We're going to do everything we can to survive. Okay. So again, adrenals, they make a huge impact here, and they play hand in hand with your thyroid. I'm going to dive deeper into this in a minute though. Then we have impaired liver function. Like I said, if the liver is gunky and it's not, you could have parasites in there. We got people who have cirrhosis of the liver, or you just have, your liver is fatty. All right. And that can come from diet. And even dealing with like high cholesterol is a liver issue. All right. So if we're looking at, if you're like, I got really high cholesterol. Okay. So your thyroid may have some challenges when it's making that conversion in the liver. Poor gut health. Again, we see things like in any kind of bacteria or imbalance, it's going to hinder that conversion and that production. And then low calorie diets. Okay, so y'all stop starving yourself to be skinny. I'm just going to say this right now, because let me tell you what happens. All right. When your body, again, this is a stress. Okay, so this is another stress on the body. And when you are in caloric debt, okay, you can get away with it for a little bit, where your body's like, all right, cool. I'm all right. And then you're not, meaning it will slow everything down. Your metabolism will slow down. All right. Cortisol is going to kick in. You're going to store fat around your belly. Your body's going to go into a survival state where, and you're probably like, oh my gosh, I barely eat and I can't lose any weight. Yep. Because your body thinks you're trying to kill it. Okay, it does. It really feels like it's trying to survive, and it's like, what are you doing to me? I have to shut things down so I can make it. God wants you on this planet. He's got a purpose for you. Okay, got news for you, and he wants you to survive. But when we start doing this kind of thing, all right, and now we have belly fat. Why the belly fat? Where does that come from? So when cortisol levels elevate, all right, blood sugar is going to release. Now insulin's going to kick in. We end up seeing a lot of people insulin resistant through this process. We end up seeing people with type 2 diabetes, because when you're constantly tapping into this, okay, again, we're releasing sugar and insulin. And guess what? Excess sugar is normally going to store in the liver for a rainy day. But when the liver storages are full, stores as fat. Guess what? It stores as triglycerides. When you look at your lab work and you're like, oh my gosh, but I eat so healthy and my triglycerides are so high. Are you starving yourself? Or are you eating a high sugar diet or a high carbohydrate diet and it's too much and your body's storing the extras, and then it's storing not just the extras in the liver for glucose, but now it's storing fat. Okay, these are telling you, welcome to my life. Isn't this fun? You're just being so educated today. Okay, so let's talk about the nutrients that are necessary for thyroid conversion. You need the B vitamins, you need copper, iodine, iron, L-tyrosine, magnesium, inositol, omegas, protein, selenium, A, C, D, zinc, and there are also other helpful nutrients like rhodiola and ashwagandha, because those help support, guess who? Your adrenals, okay? because that adrenal thyroid connection will make you or break you. I'm going to tell you this right now, and we're going to see how this works, because you stressed out people, okay, which I'm excited about. We have a new program that's coming out next month. Is stress making you fat? And this is all around the adrenals and how to fix them. Because listen, if you got a thyroid issue and you're not supporting your adrenals, you are not doing yourself a service. And let's talk about it. Let's talk about why. So in addition to free T4 and free T3 conversion, ready? 20% of this is going to kick back out of free T4 as reverse T3. And you're like, okay, cool. All right. Yeah, why is that a problem? Okay, well, free T3 is the accelerator, right? Reverse T3 is the brakes. They need to be in balance with one another. So right there, this is the natural progression, and that's perfect. That's exactly what should happen. However, when you start adding stressors to everything, okay, things get a little bit different, because what happens is stress can cause low T4 to T3 conversion. And under stressful situations, T4 gets converted to reverse T3. Yep. So if you're under chronic stress, all right, now that conversion that we want to happen so badly to make our metabolism awesome is now like, nope, I'm sorry, you're stressed, and I need to preserve things, and I'm going to create some reverse T3, and we're just going to slow things down. Oh, okay. So we look at this, and we got to understand that cortisol promotes the production of reverse T3. An active thyroid molecule is able to bind and block the hormone receptor sites. Oh, that's not good, is it? Okay. So when this happens, it leads to hyperthyroid symptoms, right? So we have, again, TSH can be totally normal with all of this too. Okay, this is just impacting now your free T3 and reverse T3. And again, is anybody looking this far? Okay. But the other thing is this, okay, you can have, here we go. Your free T3 can be in range, but it can be like at the low end of range, or it can be slightly under, okay? Let's talk about just being in range for a second. Your reverse T3 can be in range as well. But if it's above 15, when it starts getting 18 or above, it's gonna give some resistance at the cell. So if you have a weak car, okay, you do not have a hot rod, you do not have a sports car, you do not, your car is not jamming, all right? Your free T is like, I'm a jalopy right now. I'm trying to get into the garage, and the garage door is shut for business. It's going, I'm gonna let you in a little, and then I'm gonna shut the door on you a little bit. I'm gonna let you in a little, shut the door on you. Do you see what's happening here? We're gonna have some problems here. A little bit, right? Just a little bit. So people with hyperthyroidism may receive supplemental thyroid hormones to address this imbalance, right? Because we get medication for this, but this is the deal. When you're not supporting your adrenals, at first that thyroid medication can feel great and everything else, and you can have a lot of success, and then all of a sudden things aren't working well again. And you won't see it, the lab look fine, right? Because your doctor's running it, but you've been on the same dose of medication for the last 10 years. How is that possible when everything is constantly changing in your body? Like, tell me how that's possible. So we really have to take a hard look at that adrenal thyroid connection, because they talk to each other all day long. Okay. Like, again, your adrenals are sending signals, and it's talking to the body to see how much stress are you under. Okay. Do I need to shut things down? Do I need to protect the body, or do I need to let the body do what it needs to do? Okay. So this is such a key thing, because over time, if this is not kept in check, and chronic stress is not kept in check, you're going to see a downfall in the production and all, just the health of your thyroid. And it gets worse. There's more, all right? You've got all this reduced thyroid function. Why? Because you're under stress, and your endocrine system has been producing chemicals that signal your thyroid to slow down, right? And it'll do that every single time you're under a stressful event. it's going to push, it's going to slow that down, and it's going to kick reverse T3 every single time we're under stress. All right. Do you see a problem here? How much stress are you people under? All the time. Yeah. So when we see high reverse T3, it's really an adrenal issue. Okay. It's not a thyroid issue. It's an adrenal issue. So now we have to take a look at the gut. Okay. Because the gut is another thing that plays with everything, right? When you're under chronic stress, how about it? Did you know that chronic stress affects your gut? What? It affects your digestion. It affects your nutrient absorption, give you reflux. Those of you who get acid reflux under stress, oh, raise your hand, pick me. My mother, my husband, and my daughter are the only 3 people that can do this to me. Under, pardon me. I can go under stressful scenes and situations and that's fine. Don't even have reflux, but it's amazing how certain people can be more triggering, right? Still funny. I'll look at my husband and be like, I get reflux. What are you doing to me? But it is part of that whole thyroid gut function. And then, ladies, let's talk about this because we got to talk about this. Estrogen. What? Estrogen is your sex hormones. How is this? How is this playing in? Well, guess what? Those of you who are estrogen dominant, meaning you have high levels of estrogen that are not clearing out of the liver. So you have, okay, so let me give you a little tidbits. E1, E2, and E3. E1 and E2, they interchange with each other, okay? E1 is the aggressive hormone. We like to call her the bad girl, the naughty one that causes problems. When she doesn't detox well, okay, we can have damage to DNA. We could have, I don't know, cancers, ovarian, breast cancers, yeah, estrogen dominance. We all know that these things all tie in with this, right? So it's important that the liver function again is going well and estrogen is detoxing well. Well, guess what? When it's not, there is a globulin called thyroid binding globulin that can happen in the liver. Okay. Binding globulin, what do you think that does? It gobbles everything up. It binds thyroid hormone. And guess what? You have all those symptoms. Like, same thing with when you have the same hormonal symptoms. You've got the brain fog, the fatigue, the hair loss, the low libido. And you're like, what is happening here? Again, back to your liver. And back to detoxification, which is a whole other class. All right. So now we need to look at infections and gut issues because these are other things. That's right. There's more. Root causes. Again, the thyroid isn't, you have issues with the thyroid isn't a thyroid issue. That's the end result, right? It's kind of like when you get a headache and you're like, well, why did I get a headache? Am I dehydrated? Did I tweak my neck, right? Did I eat something bad? My head hurts. You don't have a brain tumor, right? It's not your head that's causing this. There's something else happening in your body that's making your head hurt. Same thing with your thyroid. There's something else going on. So we have to look at things, infections. Got to look at things like H. pylori, Epstein-Barr. Oh my gosh, Epstein-Barr is notorious for attacks on the thyroid. Like whenever I'm looking at a CBC and I see monocytes above 6. I'm looking at that and I'm like, okay, maybe we've got some Epstein-Barr going on, especially if we've now got Hashimotos, because that's one of the root causes. Same with Graves' disease. You know, could be something like Lyme, all right? Could be gut infections like SIBO or Candida or mold like me, right? All of these things are root causes. The question is, what's yours, right? So when we look at labs, all right, there are conventional ranges and there are optimal ranges. Okay, so when they figure out what a conventional range is, they basically, it's whoever's coming into the lab. And tell me, are healthy people coming in to get lab work done? No, they're not. Usually it's sick people, and they take an average of this and they come up with ranges for things. Okay, and so when it comes to optimal ranges, put it this way. You look at TSH, all right? So their range for TSH, we're looking at 0.450 to 4.5. That's a big range, isn't it? Right? It is. Like basically, and then you look at the optimal range, it's much smaller, it's narrowed down, okay? So basically, if I don't know, you wanted to go out to eat, right? And you wanted to find the best restaurant in California. You would look at a big place, right? But if you wanted to find something, I don't know, very specific, close to home that you loved, you would narrow it down a little bit better, all right? What I found is a lot of people feel different at different ranges, and there's also things that impact those ranges, okay? So let's talk about TSH for a second. If you go get your lab work done, and you're taking biotin or iron, I'm not iron, iodine, biotin or iodine, they can mess with your numbers. It doesn't mean that it's messing with the function, but it can mess with the numbers. So here I am. I got candida. I'm taking biotin. I'm taking high doses of biotin. I go run my labs, and my doctor calls me, and she's like, "Oh my gosh, you have a brain tumor. We need to do an MRI in your brain." And I was like, "Oh, listen, Sally, no, we don't." My TSH is shooting super low because I'm on such high biotin. I said, let me go back in and take a look at this. Let me take my labs under the right circumstances. Literally wasn't thinking about this, and I was done because need to get them done. And I'm pretty sure she Googled it, because she messaged me back a little while later, and she's like, "Oh yeah, that's right, that would do that." And I was like, "Yeah, it will." Okay, so take that into consideration, but it's not just going to affect your TSH. It will affect all of like your FSH, your LH, your hormones, your estrogen. Your numbers will all be affected if you're taking biotin. So when you're going to go get your lab work done, stop it 3 days before. Okay. People will tell you stop 24 hours, stop 48 hours. In all honesty, when it comes to any food, any medication, any supplement, your body needs 3 days to cycle through things, 3 days to get everything out. All right. So give yourself some wiggle room here. So we're looking at, and then the other numbers we're looking at, free T3, as you can see, you want it on a much higher range. Okay. This is sports car, right? We want it running really optimally well. So we want to make sure those numbers are good. But a lot of times, like I said, people will see their free T3 and it's in such a wonky spot. All right. It's low. Okay. And so again, if that's low and it's not working well, why? Okay. When free T3 is low, what's happening? What is that? Do you guys know? Like, why would, that is not happening, it's a nutrient issue. I'm just gonna tell you this right now. Okay. If we ain't getting everything into the cell and things aren't working well, it's a nutrient issue. When free T4 is shooting high or low, we're looking at a liver issue. Okay. It's a conversion issue. So again, back to what's making these things happen and why is this happening? We've talked about reverse T3 till I'm blue in the face. I think you guys are very, very well about that. Total T3 is kind of not something, it's not how much your body's absorbing, it's how much is bound. Okay. And so it's just a good comparison number, but it's not something that we really get all, oh my gosh, my number looks great there. And then we're looking at, thyroid, TGAB and TPOB. We're going to get into those in just a minute. Right now, as a matter of fact. So those are antibodies. And antibodies show up when we're seeing Hashimotos, we're seeing Graves, or we're seeing cancer. Okay. But this is the deal. This is conventional medicine. You can actually go into and pull up the lab and everything else, and it's saying, oh, just as long as it's not above 34. I got news for you. Functional medicine, optimal ranges, these kinds of things. We're looking at everything on a scope as far as what's coming. Okay, we're looking at what should we be concerned about. So when I pull up a lab and I'm seeing antibodies in there, I'm like, tap, 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 we got problems. You are not full-blown autoimmune yet, but your thyroid is being attacked right now, and we have to figure out why, okay, before we end up in a bad place. So it's super important when it comes to antibodies that if you have them, we got to figure out why. So what they indicate is TPOB is going to be raised with Hashimoto's, also with Graves' disease, okay? TGAB is going to happen with Hashimoto's or cancer, okay? Did you know that? And then we've got TRAB, and that comes up with Graves' disease, and we can also see that with TGAB, like that could roll there as well, all right? And then you have TSI, which is can be raised in Graves' disease, but they don't really look at this too much. I just wanted you guys to see the differences and what they are specifically. So when it comes to Graves' disease, we're looking at TRAB. Graves' disease is where your thyroid is hyper. Okay, it's cray-cray. It's not that point of where, oh my gosh, I'm gaining weight and I'm so, with hypothyroid, it's hyper. So basically, with this, a lot of the patients have raised TRAB about 70%. They have, we're looking at antibodies as well. And TRAB levels can be really high, and the patient is less likely to achieve long remission if it's going on for a long time, to be honest with you. It's something, but again, this is what you got to look at why. Okay, so when I normally see Graves' disease, we have to look at Epstein-Barr. Oh yeah, we have to look at heavy metals. We have to look at H. pylori. We've got to look at there's a bunch of things that can cause this. If somebody has thyroid eye disease, hi, Hashimoto's or Graves. Like, we got to go back and look at those. But then again, why? Again, back to the metals and all the things. And sometimes you can have negative with Graves' disease, but we've got it's interesting how it's rare. It's more rare than being a hypothyroid. And with Hashimoto's can swing both ways. You can be hypothyroid one day and hyper the next. Like it can totally flex on you because the thyroid is being attacked. And what happens when it's being attacked? It's not going to just sit there and be idle. It's going to swing. So now we look at, cancerous cells. So you're looking at TG, and TG is going to pop with both benign and, cancerous cells. And it plays in the role of helping the body create, store, and release the thyroid hormones. So a lot of times after successful surgery, this TG shouldn't even show up at all, put it that way. It's one of those things that 10% of the population they can raise in people for Hashimoto's. So just so you know, like the TG can be, you're going to have to basically go get biopsy. You're going to have to get an ultrasound to see if it's cancer. A lot of times, like I said, it'll pop and it could just be Hashimoto's, but then we're looking at nodules. A lot of times people will have thyroid nodules, and what creates nodules, okay? Nodules are going to happen when the thyroid's been under attack, okay? So you can develop tissue that's now has scars to it. The cool thing is this, okay? A lot of them are nodules, a lot of them are cysts. Did you know? Here's a hack for you. Castor oil. Castor oil packs on your neck, right? I've seen them completely disappear. I've had people with that had like 3 or 4 nodules. Gone. Okay, gone. Castor oil is glorious for this. All right. Just a little side note. So when we look at our symptoms for hypothyroidism, a lot of you guys have this. We're looking at constipation and depression. The foggy thinking is no joke, right? You could have goiter, which is the swelling around your neck, right? And that's, again, going to show up in Hashimoto's. It's going to show that there's inflammation there. Hair loss, y'all. That is real. My hair, I lost so much hair. It wouldn't grow for the longest time. I actually just hacked off like 4 inches, but I don't have that problem now. I'm just saying. High cholesterol, irregular menstrual periods, the joint pain, slow heart rate. Okay, a lot of people be like, my heart rate is so slow. And also blood pressure, right? A lot of people will say, my blood pressure is so low. And I have low blood pressure. And well, why? Like a lot of people think, well, it's a good thing, right? Well, if you're an athlete, like your heart rate can be low and blood pressure can be shooting low, but like, again, back to the thyroid and also the adrenals. All right. The adrenals are going to have a big play with what blood pressure does, period, because of aldosterone. Aldosterone is a hormone in the adrenals that controls your blood pressure, right? And which I'm excited about. Can I just go on a rant for a second? So POTS, posterior orthostatic tachycardia syndrome. Let's talk about it for a second. I think they're missing the boat. Like we look at with POTS patients, basically they can stand up and they can get their blood pressure can drop, their heart rate can rise, they feel super dizzy upon standing, all right, and they look at all the, oh, it's the nervous system, you know, it's the autonomic nervous system. But what about the adrenals? Because can't that be a root cause for this? If aldosterone is coming from the adrenals and you have adrenal fatigue, you've been in a stressful event, back to that stress thing. It can affect your electrolytes, your blood pressure, all the things. Just anyway, rant. There's so much more I have to say on that, but it's for another day and another topic. But I'm excited about it because I'm on to something. All right. Symptoms of hyperthyroidism. You'll see, oh, like this is, I think this is when people know that their thyroid medication is too high. Heart palpitations. Doctor will tell you, look out for heart palpitations, diarrhea, anxiety, nervousness. You stop sleeping well, sweating, tremors. So again, this could be hyperthyroidism, but also can be a sign that your medication is too high. So this is always when I'm, like I said, we're going down on my medication, and this is, oh yeah, when my body's getting too hot, all of a sudden I'm having heart palpitations. I'm like, it's time to run labs. And ooh, this is good. Let's move it, because I'm almost off. So exciting. Okay. There's just, it's crazy, but it's awesome because you can be fixed, people. Just saying. So back to things that block, you know, things that have not even thyroid conversion. Let's talk about things that block thyroid medication. Okay. Those of you, your doctor is going to tell you, here is your thyroid medication. Take it 30 minutes before you eat. I think what they're really trying to say is don't take it around food. All right. But this is the deal. If you eat anything with iron, calcium, you drink coffee, you have bad gut health, we can have some problems here. So what most people do, oh, I'm going to take my thyroid medication on an empty stomach with my coffee. Okay. This is going to block absorption. Okay. Coffee stimulates the bowels and moves things through the body very, very quickly. And a lot of times it doesn't even give it enough time to absorb. And it moves too quickly, right? Especially you people who drink coffee and you're like, I had to poop right away. I got diarrhea. Things are not absorbing well. Calcium is another thing. All right. So iron will block absorption. So if you're eating and you're taking your multivitamins and everything afterwards, you're not doing yourself a service. So they've done a lot of studies on this, and actually the best time to take it, ready for this? You're going to be like, this is crazy. At night, when your stomach is empty, before you go to bed. When you go to bed, everything slows down. It's going to absorb in your GI tract better, get into the tissues, get into the liver. It has nothing to compete with. There isn't stress going on. There isn't anything else, right? It's giving your body the best time for absorption, all right? It has nothing else going on. I'm the middle of the nighter. I get up to pee once a night. Happens then. And it's phenomenal. But you want to make sure if you are a coffee drinker and you're taking calcium and everything, it's 2 hours. It has to be 2 hours away from your thyroid medication. Write that down. Go change your life tomorrow or tonight. Just saying. So again, the biggest issues we see with the thyroid, it's not really the thyroid, is it? It's stress. Okay. Your internal stress, your external stress, your adrenals. Okay. So we have internal stressors, and internal stressors can be an infection. It can be inflammation. It can be bacteria. You can have all sorts of internal things happening within you, metals, right? Mold toxicity, that is going to be a stressor. Then you have your external stressors, right? And that's life. okay? Or it's not eating enough, or maybe it's fasting and you have adrenal issues, okay? And this is the thing, if you have adrenal issues and you're fasting, you're putting your body in a very stressed state. And guess what? We're going to have to kick up the cortisol. Like everything's going, it's a cycle, and it's going to release who? Reverse T3. It's going to produce it. All right. So we're going to go back and we're going to be shooting ourselves in the face. Fasting is fantastic for so many things. Okay. But it's not for everybody. I'm just going to tell you that right now. If you have, I tell people all the time, if you have adrenal issues, it is not your jam. Fix the adrenals first, because you're just going to stress your body more. Okay. We look at liver health and blood sugars. We got to look at cholesterol levels. Okay. So even looking at lab work. Okay. So lab work for infections, you look at your CBC. We can see if you've got bacteria, maybe you've got SIBO going on. We could see things through what do your neutrophils look like? Okay. If your neutrophils should be between 40 and 60, if they're shooting high, we've got something bacterial going on there. If your lymphocytes, 25 to 30, if they're above that, there's something viral happening. Okay. So maybe we've got a virus happening in your body. Your monocytes shouldn't be above 6. If they are, maybe we're looking at some mono Epstein-Barr. Eosinophils, they're 3 or above, give them a shove, because you got some parasites. All right. And that can affect everything. Or even food sensitivities. And the same thing can happen with basophils. All right. Parasites are, so those are some lab stuff you can look at. You can also look at CRP, ESR, and weight gain, and homocysteine when it comes to inflammation. All right. If those markers are high, there's something going on. What's causing it? Because I guarantee you it's going to affect the health of your thyroid. Because everything does, right? Your gut health, nutrients are getting absorbed. You see what nutrients have to be there, right? Are they even in your diet? And if they are they absorbing? Is your gut leaky? Do you have pathogens in there? Are you somebody who has gas and bloating and constipation? Is your gut health not well? Got to look at these things. So we can order things like the gut zoomer. We can look at organic acid tests for candida. We can look at SIBO tests, small intestinal bacterial overgrowth. There's a bunch of different tests that we can run to see what's going on with your gut health, okay, because something's impacting it. And we got toxins, all right? So you got your heavy metals, you got mold, you got pesticides, glyphosate. Glyphosate, ready, people? This is what they spray on wheat at harvest. It's called Roundup, right? It's on lots of things. If you are eating gluten, welcome to glyphosate. And it is not something you want to mess with, because it impacts everything in your body. Like, would you go, I don't know, eat some Roundup? Would you go like spray a weed and eat it? Think about that. It's crazy. It's crazy, just saying. So let's talk about some solutions. All right. Number one, get the right labs ran. Okay. So make sure you're getting a full panel. If your doctor will not run the full panel, reach out to us. We can run it for you. You want to take a look at that. And it's not something, I don't think thyroid, if you have thyroid issues, doing labs once a year is not right for you. Okay. You've got to be doing them quarterly to figure out if things are changing and you're making progress. Don't ever just be like, oh, I do them once a year. I've been on my medication. Woohoo. Oh my gosh. Stay on it long enough. Like, we're going to end up autoimmune. I'm just going to tell you this right now. Don't fix the problem. Don't find the root cause, and you're going to have issues. So we have to identify the underlying case, right? And the underlying cause of the adrenal thyroid dysfunction. Is it your stress? What? Is it even possible? Absolutely. You know, the root cause of adrenal thyroid dysfunction is unique for each person, because it can show up different, and it can show up in ways you don't even realize with gut dysbiosis. Lack of diversity within the gut and the microbiome, hidden infections, like I said, Epstein-Barr, you know, all of these things go back to the adrenals and the thyroid and the imbalances. Like, who'd have thought, right? And then we have to look at nutrition, because people, what you put in your mouth matters, okay? Like, it does. And if you're not getting the right nutrition, okay, and if you're literally causing inflammation with your body, you know, the main goal related to thyroid and adrenal gland is to reduce any inflammation, right? We want to get rid of that and to regulate blood sugar, okay? That's the key here. So my recommendation, eat breakfast, people. Support your adrenals, support cortisol. Think fiber, fat, and protein, okay? These are your staples for breakfast. Fiber, fat, and protein, people. Those of you who are like, I ate a bagel, I had some toast with jam. Okay, ready? Those are high glycemic foods. They are going to spike your blood sugar. Yep. And it's going to take it right into the toilet. So this is why you're like, oh, I don't feel good later, and I'm so tired, and I'm hungry all over again. You did nothing to fuel your body properly. You literally shut everything high and it dropped right off. Okay, so be very mindful as far as what it is you're putting in your mouth. Avoid gluten, dairy, and sugar. They're the top inflammatory foods. I know, gluten, right? How about it? Your gut does not break it down well. It's inflammatory, people, and also it has things like glyphosate in it, which is highly inflammatory as well. But let's take this a step further. Back in the 50s, this is when they came up with hybridized wheat. Okay, so basically, they changed things. They changed the DNA of the wheat because it was getting too big, it was breaking off and everything else. And when they changed it, they changed like basically it doesn't break down in the body well at all now. Okay, and this is why people are like, you know, back in the day, I didn't have issues with it. Two things, they probably weren't putting Roundup on it. And the other thing is this got changed. And now it doesn't break down in the gut well at all. So causes inflammation. Just throwing that out there. So let's look at what herbs and minerals and vitamins and everything else that your body needs, but not only what it needs. Let's talk about this. When you're stressed, your body goes through this stuff fast, especially magnesium. Oh my gosh. Everybody's depleted in magnesium. Magnesium is tanked when you wake up in the morning. It's tanked by the end of the day. Magnesium glycinate would be a better option at night for relaxation and helping to fall asleep and recharging that. Magnesium malate more in the morning, a little energizing there, you know, and there's magnesium threonate, great for the brain. There's lots of different things, but this is the thing. When you're under stress, your body burns through all of this stuff. You need a good multi. Celtic sea salt. Okay, so basically caring for your adrenals. If you care for your adrenals, you're going to care for your thyroid. All right. So electrolytes, Celtic sea salt or Baja sea salt has all of the minerals in it. It's fantastic. I actually take Baja sea salt, I throw it in my mouth right when I get up in the morning. I chew it up. I do. And then I swallow, and then I drink a ton of water. Why do I do this? Because I'm going to drive it into the cell. If you drink a bunch of water and then you have salt on, or you have your, you know, your great sea salt on something, a lot of times it won't get into the cell because it will get washed through the body. But you can do a little process like that and do that throughout the day, and that's going to help absorb better. How about that? A little tip there. You need a good multivitamin for the thyroid. Omegas, vitamin D, vitamin C, the B, selenium, key. You know, zinc, L-theanine, phosphatidylserine, medicinal mushrooms. Like these are all stuff for the adrenals actually down at this side of the house. Adaptogenic herbs, rhodiola. You know, all of these things are fantastic for adrenal support, which are going to do what? Support your thyroid. Okay, got to take care of both. And then there comes down to the thing that I think that everyone struggles with, and this is managing your stress. Like, let's get real. There's a lot of things out in there in your life that are out of your control. Like you can't, there's nothing you can do about it. And what do you do with that, right? You have to create some boundaries. You've got to create some space in your life. You can't get up and light your hair on fire from morning until you crash, sleep for 4 hours and get back up and do it again. You have to get margin within your day. You have to create space and find things that de-stress you. You got to have a schedule that includes breaks and eating. I think that's probably the biggest problem I see. Everybody is so compacted, jammed together, one thing after the other, and all of a sudden they're like, oh, I didn't even eat all day. And then they overeat, right? And then you feel miserable and you eat all the wrong things because you're starving. And it's a bad cycle. Like, we want to fuel our body consistently throughout the day and make sure you're getting all the right things to care for yourself. Would you treat your baby like this? If you were caring for a baby, would you be like, I'm feeding it until dinner, right? Same thing with your car. If you were like, I'm going to go drive to Tahoe today, but not put any gas in it and expect to get there. No, you would not. All right. So why are you doing this to yourself and expecting yourself to perform optimally at anything you do? Right? You need to have a consistent bedtime. All right. You need to make sure you have a shutdown, wind down time, and a good consistent bedtime and a good routine within that, and a set time you're waking up every single day. Incorporate exercise in, incorporate the right nutrients, incorporate things that bring joy to your life. If you're in a stressful state, maybe you need to delegate some things. Maybe you need to pass some things off to people that you don't have to touch every single day. You have to find peace in your life. And what I found is most people don't have it. Okay. They are just stressed out. And it all comes down to what? Scheduling. That's right. Manage your schedule well, and you can manage your life well. That's my soapbox. Now I'm here for questions. What you got for me? Anyone? No questions. All right. Not a chatty group. I think I covered a lot though. So anyway, those of you who are interested in us looking at labs, we're here for it. If you want to schedule a consult for that, if you want us to order labs for you. Also, if you want to get supplements specifically for your adrenals or your thyroid, sign up for our full script. We have a whole section dedicated just to this, and you can get the right things that you need for your body to care for it, to function in the best way that you can, because you deserve it. You do. You got to take care of you. You got a lot of people to take care of, right? And you got to make sure you're taking care of you. All right. Thank you.